Dr. Fornari is the Associate Dean for Educational Research Skills Development, the Director of Faculty Development, and an Associate Professor of Science Education and Population Health at Hofstra North Shore LIJ. Dr. Fornari received her Bachelor of Science degree from Cornell University in Nutrition, a Master of Science from Columbia University Teachers College in Nutrition Education, and her doctoral degree from Columbia University Teachers College in Higher Education, College Teaching, and Academic Leadership. Her doctoral research focused on improved teaching and learning in the discipline of ethical decision-making, and her professional interests continue to include bringing professionalism, communication skills, and ethics as paramount to the education and practice of health professionals. Dr. Fornari was Assistant Director of Medical Education and co-chair of the Division of Education in the Department of Family and Social Medicine at Albert Einstein College of Medicine, and in that capacity, she worked on curriculum development and revision, on assessment of teaching and learning to achieve quality education programs for students, residents, and faculty. And in a parallel process, she developed, implemented, and coordinated faculty development programs for the clerkship and residency training faculty, as well as a fellowship for junior faculty. Her funded scholarship centered on new education initiatives and community-engaged practice and research. I will let Dr. Fornari talk to you about all that she does at Hofstra North Shore LIJ, because she has dual roles in the health system and at the medical school. But as you can see, she brings a wealth of knowledge and skills tonight, and I think this will be a very, very valuable session for all of us. Thank you very much.
Can you hear me? Yeah, now you can hear me. So that sounds overwhelming, but thank you, Cindy. Thank you for having me here. I'm doing what I love, is teaching people how to teach. That's what I do in a nutshell. When people say, what is your job? I teach people how to teach. That's what I do. And I was a college professor for 20 years teaching nutrition, and that's how I got interested in teaching people how to teach, because I felt there were so many people ineffective at teaching, even though they had a strong discipline at the college level. Everybody was a content specialist. But I got into this whole area of teaching people how to teach, and then changed my whole life and went to a career advisor, and I said, what do I do with the second half of my life? And we figured it out, and I got a doctorate, and then met a doctor who recruited me to Einstein in family and social medicine. And I was really, really happy there and thought I was spending the rest of my life there, until I met the senior associate dean at Hofstra and said, we're starting a new medical school and we could really use you. Why don't you come there? So I had a life crisis decision, and I decided to go to Hofstra. So I've been at Hofstra since the beginning, way before we had students. I've been there 4 years, so you know we're in our third year. We're a year ahead of all of you here. So we have our first third-year class for looking at the person who's going to be heading the third-year curriculum. So we have our first third-year class. Get your complaint hat on, you know, like just listening to complaints all the time. But that's the way medical students are. It was the same way at Einstein. They just complain about everything all the time, and you know, it's just part of their behavior that I think they didn't get tested on their interview on that, but it's certainly something they like to do. And you all know I have one of those students. My daughter Marcy is here, and I really thank Cooper Rowan for taking her as a student in the inaugural class. She absolutely loves this place. You couldn't have a better PR tool than her everywhere she goes. And the nicest thing, that people who know Marcy really well in New York have said they've never seen her happier. So to have a happy medical student means you're really doing a great job here. So I really congratulate all of you. And that's great. I think it's a privilege for her to be here with so many great people trying to do good work. So I'm here to talk about a system we've developed at Hofstra. Will this work for you? I have no idea. But we were in a situation where we had people coming in to teach, and many of them had taught for many, many years, but they taught residents and other medical students, and I've been at a lot of residency noon conferences where you go in and you put your PowerPoint on and you sit down, everybody's sitting there, and today, of course, everybody's on their technology in addition to eating lunch. Usually in the past, they were just eating lunch. Now they're on their technology. And the person is going through his stuff, and he gets through his stuff, and he says, are there any questions? And maybe one person will ask a question, and then noon conference is over. So we had a lot of people coming from the clinical side, because the medical school is a marriage of Hofstra University, but really the content of the medical school is coming out of North Shore LIJ Health System. Hofstra University is a liberal arts college. They don't have a lot to offer us in terms of content experts. We use some of their science people, but basically everything comes from our Feinstein Institute and the health system, the clinician people. So these people were not used to teaching in the mode that Dr. Larry Smith put forward, and we really needed to develop them to do this. And we're developing them every second, like constantly. I have somebody speaking this week that I just spent 9 hours with. He's a specialist in, I know everything about muscular dystrophy, possible. So I become a content expert and he becomes a better teacher during this process. But he's never taught in this methodology. He's given many talks on muscular dystrophy. He just never taught in an interactive way. He presented me 80 PowerPoint slides and said, this is what I'm going to present. And I said, no, that's not what you're going to present, you know. And after 9 hours of work, I hope it goes well. And then I pray and I hold my breath and wait for the student reviews, of course, the critics. We evaluate every session and we get critical feedback from them. And then I was explaining to Cindy, we have a new system we're putting in there of peer evaluation. We've gotten to the level where we feel we could begin to now to have peer evaluation of the teaching in a formative way. We're just getting to that level where we feel we have some solidness and do some peer evaluation to go from good to great, sort of. So I'm going to share with you a system that we have, and if it works for you, then great, and if it doesn't, then you'll say we won't invite it back, you know, something like that, okay? So these are our guiding principles. First I could say they're Hofstra's, but I think they're guiding principles for session development no matter who you are. I'll be honest, they are ours, but they apply to you as well. That you have that we have a principle of an adult learner environment. So we're not teaching young kids anymore, we're teaching adults, and they have to be responsible and accountable. We're integrating health, disease, and intervention, which I think you are. Integrating science and clinical. All your students have meaningful patient experiences. I've heard about them firsthand. Focus on learning, hopefully, and not teaching. You have small group learning, which we're not talking about today. You have assessment, and then thinking about critical thinking. And then you have missions, values. We have mission, and we have values and drivers. I don't know exactly what you have, but of course you have a mission. It's just normal to have a mission. So here's what we're talking about when we talk about integration, and you have to teach with integration in mind. Because we're no longer just teaching basic science and clinical science. We're combining everything. So it's basic science to basic science to clinical, clinical to clinical, and then science to clinical. So there's this whole integration path that comes out when you do things like normal, abnormal, and then intervention stuff all at the same time with the students. So it's constantly integrating basic and clinical science. That's an overall arching goal that we have. So before I show you I'm not going to show you this one. This one is not. I'm going to show you one at the end, another one. But, so one of the things we're very big on is that every session has goals. Now, I don't know if this is exactly the way you do it, but we have goals. And these are my goals for the session today. And what I'm doing right now is the purple goal on top. I'm doing the first goal. And what we say to the faculty is, we want you to have 2 to 3, 4 is a lot, but usually 2 to 3 goals that you want the students to accomplish at the end of your teaching session. Those are not the learning objectives, those are the goals. Those are the higher order thinking things that we want the students to leave with. This is probably the most difficult concept I have getting across to faculty. Before I go on to this, so under each of these goals, there could be learning objectives, but we're not teaching to the learning objectives because the learning objectives are addressed in the pre-work, whatever the pre-work is. It could be a flipped classroom design, it could be reading, it could be videos, whatever the pre-work is. It doesn't matter what you call it in this pedagogy world, flipped classroom, whatever. There's pre-work, and the pre-work really goes over the basic objectives and is very basic. The goals are much broader and are what the faculty should be teaching to. So at the end of the session, if the students understand whatever the goals were, then we've accomplished the task. Okay? This I basically said. Okay, so when I think about here, you should begin to think, what are some of the guiding principles? Because we present those guiding principles to every faculty member who's going to teach in the classroom. And we go by those guiding principles, and we sort of use it like a checklist, that they have to do all these things. So you should begin to think, what are the guiding principles for learning for your students, that no matter what topic somebody's teaching, this checklist applies. The other thing that we do is every course has a weekly theme. Do you have that here, Cindy? Themes for the week? I'm not sure. Maybe not. So I might not go over this. Okay, we have a lot to do, so it's okay. So basically, I sort of went over very quickly because I want to get to the meat of what I'm doing. You have to think where large group sessions fit in at Cooper Rowan. Well, Marcy says to quote CRS, whatever, what? CMSRU. CMSRU. I have enough trouble with the Hofstra name, so I can't even get another one down. So you have to think, like, what is the purpose of the large group session? Because you have your case-based ALG groups. So it's supposed to be supplementary to those learning groups that they have. So it's a different philosophy to think, where do these sessions fit in and what do we want to accomplish in these sessions? Okay. Any questions so far about the goals? Okay. What's happening? Is that the next one? Okay. So a large group discussion, is it always a lecture? How do we define it? When is a lecture appropriate? Is retention an issue? So what do people think? Any thoughts on any of these questions? Is a large group discussion always considered a lecture? Okay, so it can be an interactive lecture. What are some characteristics of a lecture? When you see a true lecture happening, what are the characteristics of that?
Only one speaker in the room.
Right. One voice, let's say. How about that? The person who's speaking, like me right now, and now you spoke. So we're going to try and have a discussion, you and I, okay? So that's one of the things. So there's many voices in the room with a large group interactive session. Generally, a traditional lecture, the famous lecture, you know, when you look at videos of famous lectures, is one person is speaking. Is it appropriate to ever have a lecture? What do you think? Many of you like to lecture in this room. What do you think? When is it appropriate to give a lecture?
At a TED Talk.
At a TED Talk. I love TED Talks. I'm a big TED Talk. Why are TED Talks great? Why do you like TED Talks?
18 minutes.
18 minutes. So you have 18 minutes to get your point across. A little longer than the elevator speech, but you have 18 minutes.
And good pictures usually.
Pictures, and what do they do also in that talk? There's one characteristic of most of the talks I've seen. Anybody?
Draw.
Some people draw, I know. What? Who said the P word? Where? What did you say? It's a story. They tell lots of stories, these people. So in 18 minutes, they're also engaging them through a story. A story is a great way to engage. So you get all involved, even though it's 20 minutes of talking. It's very story-like. So it's great. Do you feel you have retention on a TED Talk?
Probably about a third.
Yeah. Okay. Not bad. A third. So TED Talks are very effective. But one of the key characteristics is they're never longer than 18 minutes. So that's a good judge for you in your lectures, and that's exactly what we recommend to our faculty. They have 50 minutes in a single session. If it's a double session, they have 50 minutes, 10 minutes break, and another 50 minutes. But basically, they have 50 minutes, and no more than 20 minutes can be that person talking. The rest has to be interactive. And that's pretty much a rule we have. Okay. So in an effective lecture, just like a TED Talk, you stimulate interest in a subject. That's one of the purposes of it. It's a great way to frame. So when I work with new faculty and they're like, well, I'm the content expert, don't I have to tell them something? That's why you have me coming 20 minutes from the health system all the way to the medical school. It's not across the street like here. They have to take one of the highways with traffic and all that stuff. You know, you're having me do this activity. Yes, and I allow them to do a small framing thing so they feel happy. They probably don't even need that framing thing, but it makes them feel better. Like this guy speaking on muscular dystrophy, he has 3 or 4 framing slides that he wouldn't give up for anything in his life that he had to present, you know. And I'm sure it's going to be fine, but I narrowed it down to like 4 that he could have. But that's sort of the framework, and that's okay. And the idea of the talk, though, is to stimulate thinking and curiosity. So the techniques that you use to make it interactive have to stimulate thinking and curiosity. So what's one of the best ways to stimulate thinking and curiosity in learners, in the students you have? What's a technique? Simple technique. Use it all the time. Questions. You ask questions, right. Just by asking questions, you're stimulating that. The problem is, when you ask medical students questions in a large group, what happens generally? Describe it. There's silence. Everybody, there's silence, right.
One person.
Or one person monopolizes, right, 2 to 3. So we really try and work with faculty, and the faculty from the outside, we call them the students call them the visitors. They don't like that, but that's what the students call the people who come from the health system, the visitors. They have a really hard time, like, calling on people, but we really encourage them. And the people who are in the building all the time don't have much trouble. But there is generally a period of silence, which is what you said, and being able to wait. I have a great video, but it's not, I mean, it's a good video of content, but it doesn't show well because it's not well made. And it's somebody teaching pulmonary physiology, and he asks this very basic question, and you'll see the whole room of students are silent. And I thought, when I was watching the video to pick up pieces to show you, I thought he was going to start teaching the topic. And it was about how inspiration and the diaphragm and all this stuff. But he didn't. He waited, and he waited, and he waited. And finally, one student went like this and raised the hand and started talking. And he probed with another question. I was really proud of watching this video of this person because he held out. And we really have trouble holding out. We really do. Because you think you're losing precious time to present what? More information that you think they need. Right. So it's really important that you hold out, okay? And ask questions, but wait for them to answer. And if they don't answer, you have to have a follow-up probing question to get them to answer. So you have to have in your back pocket that probing question. That's what I teach faculty. You must have in your back pocket. When they don't answer you, step back. And I think you'll actually see one of the techniques in the video I'm going to show. Okay. So we talked a little bit about excessive content, trying to get through a huge amount of information. I worry about this all the time with faculty. You know, they say, oh my God, I'm never getting to the last slides. I better start talking quickly. No clear objectives or goals. Not understanding the pre-work that they gave, and not checking understanding in real time. That's one of the things we really promote. How do you check people's understanding in real time? That means when you're with them in the room. Do you have any system here that you do that? Do you do automated ARS? Some people use ARS for that, where you could give them a quiz and you could check their understanding right away. That's one possibility. Some people give little quizzes you could do. There's a few techniques to check their understanding in real time. But basically, this is your job, is to ask questions, listen, respond, explain, open and close a session, and do adequate preparation to make it happen. That's your job. There's no lecture word in there. Michael's not agreeing with me. He's shaking his head no. What? Oh, you do agree with me? So on your right here, hopefully this is what you're achieving. So would anybody argue that you don't want the right? Everybody's in agreement on the right? Okay, because this is really what we want from students. I'm going to give this PowerPoint so you don't have to take so many notes. But really, the left is the key job you have is to prepare questions. That's your key job, is having the right questions. And I could show you, and if anybody wants to stay after, because I do feel concerned with time, I could show you a PowerPoint that I just had a young junior faculty member, brand new pediatric oncologist, speak about platelet aggregation, which I also know a lot about now. Because I learn about all these topics as I prepare these people. And she never taught in this environment before. She's very young. She's just out of fellowship. She's brand new. And they give her this talk to do on platelet aggregation. The chair of HemOnc says to do this. And she knew the content well, but she never taught this way. And you could see how I had all her questions on the slide to make sure she asked all her questions. So somebody who's really novice like this, I make them put all their questions. And even this guy speaking on muscular dystrophy, he is not novice. He's very senior. I'm surprised he's even coming after what we put him through, because, you know, he's really senior. But I made him put his questions on the slides also, because he's not used to using questions. He's just used to talking. So in a very deliberate way, if you've read the literature on deliberate practice is doing the same thing over and over. So putting the questions on the slides is a way of deliberate practice. So that's really your main job. And then listening to what the students say, having a spontaneous response that makes sense, because you don't know what they're going to say, so you have to do that spontaneously. And let's say it's wrong. Let's say the student answers wrong. What would be your next step? Any thoughts?
Ask another student.
Good idea, thank you.
Does everybody agree with that?
Right, questions like that. So what does everybody think of that? Is that what you thought was the pre-reading? Go back to the pre-reading. They have to do the pre-work, so you have to constantly bring it up. Or say, you know, what was your thought process behind that? So you're not saying they're wrong in front of the whole group, but obviously there's something missing from that. But if you right away correct the student, nobody will answer the question the next time. That will cut down the answers to future questions. So the minute they see how you operate, they're going to learn your behavior, and they're going to role model what you want. You don't really want them to answer questions. You really want them to sit there and listen to you. So it's very important. Okay. I just want to mention about pre-work. I know you give pre-work. I mean, I have a child who goes to the school. I know you give pre-work. We give pre-work too. Our students are 100% accountable. I've never seen such a system, honestly. I taught college for 20 years. Believe me, I walked in many classrooms where nobody did anything they were supposed to before the session. And I'd be so frustrated. I mean, if you calculate how many classes I taught in 20 years of college, and I always taught summer school also, so year-round. Our students do the pre-work because the fear of God is in them, that something from the pre-work is going to be brought up. And it's that they need to know the pre-work. They need to understand the pre-work. You're not teaching the pre-work. You're teaching the application of the pre-work. And they really know that. And I have to say, when I work with faculty from the other side, the visiting faculty, whatever we call them, they always say, they're not going to do the pre-work. I have to teach all those basics. They're never going to do the pre-work. And then when they leave the session, the one thing they say to me always is, they really did the pre-work, like you said. Even if they weren't happy with anything, they always say they did the pre-work, because our students know already that they can't function in the large group without the pre-work, because the level of teaching is so much above the pre-work that they'll be like lost. And like every medical student, you know, they want to do well and they have the fear of God in them and, you know, all that stuff. Okay, so let's talk about developing a session. So I talked about your role. Any questions on your role? This idea that your role is shifting to this facilitator, asking questions, listening, responding. Any thoughts? Okay. Oh, I do have a little on learning objectives. Okay, I'll do this quickly. What do you think? Quickly? Okay. So this is the difference between goals and learning objectives, and I gave you an example. So the goals of a session build upon the learning objectives and offer something beyond what the students read. It relates to information across scientific topics or a connection between the science and the clinical. So the goals are very broad and the learning objectives are very specific. So take a look at the goal here. Who could read that goal for me? Somebody read it. We're in a hurry here. I'm going to New York and you're going home. Come on.
Understand how to create an interactive large group session based on goals.
And objective, right. So that's a goal. And what's the learning objectives for that are underneath. They're very specific. So describe the curricular philosophy. Define goals and objectives, an example. Explain how to create interactive questions, which we're going to do in a minute, and review the diverse in-session tools available to support an interactive session, which I gave you a handout of a menu of pedagogies, and I gave you that. We probably won't have time to go over it, but I did give it to you as a resource of different tools that I've gathered over the years to make sessions interactive. So who identifies the learning objectives here? Cindy, does the school do that and give it to the faculty, or do the faculty? Sessions with the faculty, right. That's similar to us. Most of the time the faculty say, why don't you give me an idea what you want, and then we ask them if they agree with it or not. It usually works better that way, but right. So basically, we give them the goal, though. We give them the goal, absolutely, that we want the students to leave the room with. The learning objectives, we try and have them identify the more finite, detailed stuff. But many faculty struggle with this, so it's more efficient sometimes if the course director writes the learning objectives and gets the faculty to edit them, agree with them, throw something out, add something, something like that. So the goal is the 3 main take-home points, and the learning objectives are that. So when we think about this, for us, we use, anybody familiar with Bloom's taxonomy here besides Sue Perlis? Okay. So we use Bloom's taxonomy all the time. 1956, he developed this. It's still around. At teachers' colleges is a very big thing. But someone revised his. It doesn't matter which one you're using. But over here, this is what you're focused on, the pre-work. The pre-work is at a very low level, at a low level of remembering, understanding, knowledge, comprehension, whichever one you're using. What's happening in the classroom is the application, the analysis, synthesis, and the new one has creation, which of course is really high, which you create new material or like scientific discovery stuff. But the application, the analysis, synthesis, and evaluating pieces of this is what's happening in the classroom. The pre-work is this foundational knowledge. A lot of times this is presented in a pyramid. I actually don't like the pyramid. I like the way this is better to show you that it's foundational. Did I do anything wrong?
No.
Thank God. Okay. This is a terrible slide, but what I wanted to show you, I know it's terrible, I could not make it better, so I put these words on the bottom, that if you take a lecture and you take reading and you take a visual, something like on a CD-ROM, like a video or something, and then you take discussion, and then you take experience, and then you have them teach others, that's when you get to retention. All those steps. That's exhausting. It's absolutely exhausting. So what we generally do, I won't walk over there, what we generally do is we stay down here because it's much less exhausting. I should have an exhaustion scale on here. I never used this slide before. But here is where we stay because it's easier. Once you start doing all these steps to get to retention, it's an exhausting process. But this is really what it's showing you, that teaching others the 90% retention rate. If you just count on the lecture and the reading, which is what those blurry words say, you're at 15% retention rate. So you've totally wasted your time with a lecture. And how many clinical revenue dollars did people miss by coming across the street? For us, it's practically 3 hours of time because they have to travel on a parkway that has traffic come to the school, and then go back to the air and find parking back at the health system. It's a really big nightmare. So it's like 3 hours of revenue time that they've lost. So if they're going to come and just do a lecture and not have retention, they've wasted their time. So this idea of discussion, which is 50%, then something experiential happening in the group, which we're going to do in a minute, and then all the way them eventually teaching others, which they do in their small group settings. Any thoughts on this? Sorry about the slide. Yeah. But what I liked about this slide is the rapid e-learning will not drive mastery. So we think by having them do something online only, they'll learn it. No, you have to bring them back into discussion and all that afterwards. The other thing is, this is another Bloom's taxonomy with a pyramid approach, but the self-directed learning, we also call that pre-work. Sometimes we don't talk about pre-work because we call it self-directed learning. And the interactive stuff, as I said, is happening. So that's another concept, that the pre-work entices self-directed learning. Okay. And now we're going to get into thinking about questions. So the question types that you ask are really important, because if you ask questions down here, like name, define, identify, summarize, even interpret something, you're basically at the bottom of Bloom's taxonomy here. So when you say the student is not able to critical think, the student is not able to reason, all those things, maybe you haven't asked questions that allows them to go up the pyramid. So the questioning has to revolve around organize, solve, examine, compare and contrast, defend, appraise, develop, predict. All those verbs need to be in the questions you ask, which is why you need to prepare your questions at home before you get to the session. Because you're not going to be skilled enough. I don't care what content expert you are. I don't care how much you know every one of your topics in here, just like I know my education. You're not going to be able to have higher order questions on the spot, because you're not used to designing questions. And when you're in a hurry, you go to the lower order questions. It's just the way it is. And you go to the easy questions, and the students can answer it, and then they're never challenged. And this happens in third year also with residents in the clinical setting all the time. I always had complaints at Einstein Montefiore that the students, what did you teach them? They can't think, they can't do this, that. And I say, what question did you ask them? Oh, I asked them about a drug. What question? The name of a drug. I mean, if you ask them the name of a drug, that's a very low-level question. If you don't ask the mechanism of the drug, then you really don't know what they know. So this idea of having verbs that test the higher level of this pyramid is where you have to be. And you must practice writing those questions at home and work on them. So I made up this example. Who wants to read the vignette? I think this can relate to this school. Who wants to read the vignette? Come on, somebody, quickly.
Medical student
Thank you.
preparing to pursue a community service activity.
That's the vignette, okay? So they do community service here, I understand. Okay. So the first question is a remember question. Who wants to read that question? Quickly, let's go through this.
Can you describe the steps required
To completely identify the
needs of community-based activity?
Right, so can you describe the steps? Very simple, base question of doing a community activity. What's understand? Who's going to read? Go ahead, continue, just so we get through it. Go ahead.
Why is a needs assessment a very critical first step in planning a community intervention?
So you're getting slightly higher here because you're going to why. Slightly higher, but you're still at a very basic level. Then you're getting to your next steps. You're at your application stage. How about somebody from here? Read the application.
After data is collected for a needs assessment, how can you apply this to planning a community-based intervention?
Very different question. Requires a lot of thinking. Analyze. Who wants to read that? Go ahead.
How can you align data from the needs assessment to the proposed intervention and modify plans based on data gathered?
That's a lot of work. Much different. So you want to align the data to the intervention and then modify. It's a lot. Evaluate. Next one, somebody? Go ahead, thanks.
How would you assess the outcomes from the intervention? How will you compare and contrast your intervention outcomes to those anticipated in the planning stages?
So that's really a lot of work. And then if you were going in to create the highest level on the new revised Bloom's taxonomy, read this one. So this, someone?
How will you adapt the intervention's outcomes to influence and sustain community-based change?
That's really tough. We know community-based change is tough. So when you think about designing questions just for that simple vignette, a medical student preparing to pursue a community service activity, if you don't get to the higher order questions, they're only going to have the baseline knowledge. Okay. So basically, when I work with faculty, before I do this, I think I'm going to try and show this video. This is a very, very young faculty member. He couldn't be any fresher. Not in the negative sense. He came to us from a Massachusetts program of esteem, but he never really taught in this way. He is so receptive to learning how to teach in this way, and this was one of his first talks this year. I'm going to show you little clips of it, I hope. This is not my forte. I'm going to tell you right now.
Immune system, we're going to cover the barrier functions and go over the big picture of the innate immune system. And there's a Word document online.
Just listen to him more.
This is the first section on immunology. My name is Dr. Joel Stern. If you have any questions and office hours, just schedule an appointment with me and we'll meet your expectations. So this is the first class on the innate immune system. We're going to cover the barrier functions and go over the big picture of the innate immune system. So the immune system is a process, it's a system that defends us from foreign pathogens. So we're going to have an overview of the cells that are involved in the innate immune system. We're going to go over the epithelial barriers as well as the different cells that are involved in the innate immune system. Can anyone tell me what the neutrophils and macrophages do? They phagocytose. Great, great. And what about the NK cells? What are those? What does NK stand for? Okay, great. And what do they do? What do they do in one sentence? In one sentence. They kill, right? That's good. They kill, absolutely. Okay, then we're going to go over the different plasma proteins, and then we're going to touch on the receptors, the pattern recognition receptors towards the end. So here we heard yesterday from Dr. Willie about all the different pathogens. We have viruses, bacteria, parasites, and fungi. What are the two arms of the immune system? And adaptive. Great. Can anyone compare and contrast? What are the differences between them? Just give me one specific example. One is specific, right? And the other is not as specific. Which one's specific? Right, the adaptive immune system. Are there any other differences between the adaptive and the immune system? One has memory, exactly. One has memory and one doesn't. Which one has memory? The adaptive, right? And what about, is there another difference? Single clonal versus multiclonal? Okay, yes, good. Okay, so just to brief, okay, the innate system, the innate immune system is invariant, it's early, and it's our first line of defense. The adaptive.
Okay, turn that light on, Cindy. So what did you see in this situation here? You don't have to really see him because you just had to hear him. What? He was asked, but first he set up the session. He did set up the session. Now, I worked with him. He never thought, this is all new to him. So he set up the session, and then he did this little question answering. What was he doing in that question period? What do you think he was trying to accomplish? Of if they did the pre-work. Because these were basic questions. You'll see he's going to ask much harder questions later on. But for a few minutes he was asking to see if everybody was on the right plate of things, right? He referred to something they did yesterday in a session. So he's trying to get them to realize that he's looking out at the pre-work and are they on the same plate, so that's great. None of our speakers are allowed to stand at the podium either. I don't know what you do here. They must stand in that center. We have this amphitheater type thing like you. We don't allow them to stand. That's another thing they get upset about, because they can't have PowerPoint slides with notes on them. Okay? Because they're not at the podium to read the notes. So that's another variable that has to be adjusted. So he started asking questions right away, and he gave positive reinforcement. Did you notice that? So right away, what does that say to the group? They really don't know this guy. He's brand new. This is this might even be his first talk ever in the school. He's co-directing the immunology course. He made it a pretty safe environment, and he's a pretty, you know, tried to come across who he is a little bit, okay? So everybody saw that? Okay. I need like stronger glasses for these numbers. Okay, I want to go up to 3. I'm jumping ahead because I'm concerned. Here he's using a video clip but asking questions through the video clip. I want you to see this. Oh, sorry. I can't get it perfect.
All right.
This is Back to the Future.
So most of Bit's body was protected by what tissue? Skin. Okay, good. Right. This is going to be easy. So what happens if he gets some particles in his mouth? What are the defenses in the mouth? Okay, that's correct. But what are the first? What are some other defenses? Like first, like what enzyme? Yes, Mike.
Is I think lysozyme and the saliva.
Yes, absolutely. So that's the first one. It's not really strong enough to destroy and disrupt all the cell walls, but yes, that is our first line. And then we also have chewing. Okay. So what happens if the pathogen enters his stomach? So it gets past the mouth. Now it's going into his stomach. Right. There's an acidic environment. Exactly. And what's the pH roughly? It depends on what you've been eating, but on average, where would you put it in this chart? This is a logarithmic chart. 1 to 2, absolutely, yes, somewhere between lemon juice and battery acid. Definitely. So it's usually on 1 to 2. It's closer to battery acid if we have to gauge it. And also vomiting is another reflex. So what if he inhales some of the particles? And this goes to our question, Rob, right? So you mentioned mucosa, absolutely. So it's mucosa. So what defenses are in the mucosa system? What do we produce? Lots of mucus, and that's produced by goblet cells. Okay. So just to recap, we produce about 1 liter of mucus per day. And cilia also is also.
So he's doing a recap here.
Cilia also helps trap different pathogens. So which immune cells would the pathogens first encounter?
Okay. So there he used a video clip. You want to turn the light on? Oh, she's doing it. So there he's using a video clip to prompt some questions from the students. One of his advantages is he's young, so he knows all this stuff about, you know, doing some of these things. He's really good at this technology stuff. So what do people think about that questioning style? First of all, the video clip got their attention, and then he tied it all together with his questioning what he was trying to accomplish. And that video clip, obviously, when the movie was made, had nothing to do with immunology, but for some reason he remembered that movie and figured this whole thing out. And then he did a little bit of a recap. Did I show the recap? Let me see if I'm at the recap. I wanted to show you how he did, he said, I'm going to do a recap. So a recap is a really important part of lecturing. A recap is a really important part of lecturing because when you do a recap, you stop for a minute, take pace where you are with the students, and see if there are any questions before you move on. It's a really, really good technique. Now, what is that problem of doing a recap for you as faculty? Why do you think people don't do that? it takes time, and people think I'm not going to get to the next topic. They're going to ask questions, and people get nervous. But it's really an important piece of like slowing it down for a minute and making sure everybody's with you. Okay, I'm going to show you this. He walks through this image, 8:15. I want to show you how he walks through an image. No. Okay.
Yes, and then number 2, yes. So in the alveolar sacs, we're going to encounter these little immune cells, and here they are right here. They're just hiding out. There are just a few of them. This is not on scale. Okay, so here, and this is not really how they phagocytose out there, right? So we don't really like keep them like that. So, but we have a clip though of how they actually phagocytose different pathways. So these are silicate dust particles. Some of them will leave the system, and others that are just hanging out along the side of the alveolar wall will then phagocytose the particles, but they're foreign, so they're not really well recognized. So, and they really don't know how to digest them, so they'll go through extravasation into the tissue, and then once they get into the tissue, they'll start secreting different factors that will go into, and this will attract, these factors will attract other cells, in this case fibroblasts, that will surround that cell because it's not doing that well, and it will eventually contain the cell and die. So what do you think if you have a lot of these? What will happen if you have a lot of these? Yes. Yep. Fibrosis, yes. And what will happen to your lungs? Will you be able to breathe as well? No. So it'll just accumulate and eventually it'll be harder to breathe.
One more. Go ahead. Okay. So I thought what would be good now, let me see where we're up to. Okay. So if we look here, so what it was, this actually wasn't the right, he had another image slide where he actually had the student talk over the image what was happening in the image. That was not the exact one. But you could have a student actually describe what's happening in the image versus you. So that's another technique. Okay. So generally when I talk to faculty, how do you make it interactive? I mean, he's doing a topic that has all that media and diagrams. But generally for people who come from the other side, as I call it, we have a few techniques. We use cases, we use images, and we use problems. So generally that's what I say to a new faculty member. So how do you want to make your session interactive? So the guy who's doing muscular dystrophy, he had these cases that he wanted to present. They were so complex, like, you know, there's those zebra cases that nobody except the specialists like him sees. So we had to temper them down so the student could understand it. But he wanted to use cases. Other faculty, so you could take this case and say, okay, what do you want to teach through this case? What's going to be your goal of using this case? Or you could look at these images and say, okay, and this is pedal-edema and diabetic nephropathy, which the patient has, and how do you want the student to explain to you what's happening physiologically to this patient? So you could just have these two images up and ask students to explain what's happening based on the symptoms. He also has gastric reflux, so you could put an image up here and have a student explain that. And the last thing you could do is a problem set related maybe a little bit more to the management and the use of oral agents and metformin or whatever you want to do, or if it's in using insulin. You could have a whole problem set. Is everybody with me? Any thoughts on that? This is my easiest way to get faculty to think about being interactive.
How do you use the problem set during the
Session.
During the session.
So basically, I was going to show you in a minute, I could show you how he does a think, pair, and share. He does a whole think, pair, and share on a problem. I can show it to you. I'll show it to you in a minute. But basically, a problem set like this, I usually would tell the faculty member if they want to use a problem set, to have the students think, pair, and then have a large group share as the activity. It works very, very well. So the greatest thing about think, pair, and share is it can happen in a large lecture. You don't need to be in a small group room. The student thinks alone for a minute, then they pair, like I pair with you, just to the person next to them, no movement required. And the nice thing is if I say, well, this is what I think, and it's wrong, only he's thinking it, hearing me. It's only one person who's hearing that I'm wrong. And then that person might say, well, I thought about it this way. Then they have a little dialogue, but it's only two people, so it's not so scary. It's not like they have to tell the whole group. And then when you share, you've come up with some agreement, so you've pre-thought your answer automatically, and then you're able to share it more intellectually or more intelligible to the rest of the group. So it's a great technique. So usually with a problem set, I recommend to think, pair, and share for a few minutes. For a case like this, if you just used a case like this, you could just have one of the students read the vignette, and the students could read the physical exam themselves. That's what I recommend usually. And then have questions of what you're trying to teach. I mean, how many things can you teach through this STEM here? There's, so many different topics. It just depends what you're teaching. So you have to have the questions geared to your goal. Okay? Or if you really wanted to focus on the symptoms, these two symptoms, you have these images, and you ask questions related to this. Okay? So this type of probing learners is really to get at the higher order thinking, and it's through questions. So when we think of questions, we think of clarifying questions, which you saw him do in the beginning. He did a lot of clarifying questions. How long did it take, though? That clip was 2 minutes, maybe at the most. Then you get into probing questions. Then you ask rationale, why, if someone says something. Then a viewpoint and perspective, and then implications and consequences. So there's different types of questions that you can design. And generally, if you don't get to the bottom, if you stay at the top with just the what questions, those are lower level. You want to get to the why, how, and what if questions. So if you're constantly asking questions with what, describe, identify, those type of things, then you're getting to low-level questions. So you really want to get to the what, why, how, what if. Not what. I mean, why, how, what if. So I thought now we could do this activity. Tell me time-wise, what do you think? I know, we're tight. Yeah, we started late. So she has some goals and objectives, and if you don't practice writing the questions, then you're not going to get good at this. And if the only thing you learn how to do today is to think about better questions to ask the students, then you're in better shape. And then think, what do I need visually? Do I need this case? Do I need these visuals to ask the question? What's going to be my little trigger? We call these triggers. His images that he had up there are triggers. The movie was a trigger. That whole cell thing, whatever that was, I know a lot about immunology because I helped him prepare 4 talks. But that whole cell thing, that phagocytosis, those are his triggers. And I want to show you how he does the think, pair, and share. Or you want to use a case, because many of the clinicians want to use cases. And the greatest thing about medicine is you don't have to make up cases. You all have cases. Everybody, every doctor I speak to says, oh yeah, like this pediatric, the one who did platelet aggregation. She had a great case, and she taught through the case, the entire thing about platelet aggregation. She had a hem-onc patient and dealt with it. So cases are the easiest way to go. Finding these images on the internet took me 2 seconds. I Googled pedal edema and I got this. I mean, it didn't take long. It's not hard. Probably my 9-year-old nephew could do this. It's unbelievable what they can do. Problem sets take a little longer to put together, but some people really like to teach with problem sets. It's okay. It's fine. It just takes a case just as easier for people. So this is... Of course you can. What level question is it?
It's a very basic one, don't worry.
Okay,
So,
I'm preparing myself.
a lot of us use a lot of the techniques that we have shown. The problem is that we don't always have students who are appropriately preparing for class. They're not doing it.
This doesn't work.
How do you threaten your students to do the free?
Because we don't go over basic information in class. And the minute they see people doing that, they'll revert back. So we don't do it. I mean, we definitely don't do it. The fact that he did that little bit of testing in the beginning is the extent of basic information we go over. I mean, if I showed you this talk on muscular dystrophy, I mean, I'm a nervous wreck, obviously, about this talk because I've talked about it 3 times already here. He's giving it Wednesday morning. Because it's so high level, like, if they don't do the pre-work, I don't know where they're going to be, these kids. I mean, it is ridiculous. It's so complex what he's talking about. Inflammatory, non-inflammatory thing. I mean, it's crazy. But if they don't do, now he did have good pre-work that they have to read. Otherwise, they're going to be lost. And if they say that it was too, we could tell if they can't answer any questions, they didn't do the pre-work, because the questioning is a process that leads them through it. So by giving in and starting to teach the pre-work, you're developing the behavior. I mean, it's like giving more metformin to a diabetic who tells you they're eating a cheesecake. You know, it's the same thing. I have nutrition examples all the time. You know, or it's like saying to the person, you know, I'm going to give you more insulin so your blood sugar will, you know, be in the right range, and then you could eat whatever you want. And then they say, well, I'm gaining weight, you know. Whatever's, you know, it's the same thing.
Is it ever appropriate, because I was noticing when we go back here and you're asking all the people, it's easy for us not to participate. So, and that's what happens with our students too.
Well, we talk about, you have an amphitheater like we do upstairs, and faculty are always talking to the right, you know, it's just the way it is, and forgetting the left.
Is it ever appropriate, instead of just standing in front and asking the questions for everybody to respond, to use like a little worksheet to start when they come and say, listen, I'm going to give you a little worksheet based on the pre-reading, have them do that, and then do something like that, have them hand it in, or just have them look at it?
Well, I wouldn't have them hand it in because you have no time to look at it. I mean, you have to think what's realistic. You don't want to have them hand something in that you're not going to look at.
Right.
So if the worksheet is to probe their thinking, which is what I think it is,
Yeah, or just to kind of get them motivated.
well, you're trying to get them in the moment with you.
Right.
Listen, I mean, I'm not giving a talk on general learning theory, but for learning theory, you want to get them in the moment with you. You know, I did a lot of residency work at Montefiore in family medicine, and all the family people in the Bronx, you know, were totally stressed out. You can imagine healthcare there. You know, it's like here. You know, it's not much different. And they'd get in the room, and I'd say to the people who were teaching, I'm teaching them, you have to get them in the moment with you. Who knows what they just came from? Everybody comes from somewhere, so how do you get the learner with you? So if your little quiz gets them with you, okay, we're going to talk about this, or showing a video clip, you know, like he's showing about immunology, this is what we're doing today. Who knows where they came from, what happened to them the 2 hours before coming to the session or whatever. That's very, very good learning theory work to do, to get them in the moment with you. So you're preparing them. I don't think you have to collect it and look at it, but you could have them turn to a neighbor and do a think, pair, and share with that, so they talk about it a little, because that will enhance the learning besides filling out the blanks. And I could show you his think, pair, and share in a minute. I have it on video, so you see how he did that. So the pre-work answer to your question is that if you give in, this won't work. You know, then, you know, it doesn't work. So you have to be stringent.
Yeah, and I'm just thinking that in terms of the stuff that I teach, so I give them biochemistry. And we accept students who come in who have never had biochemistry.
They have to do more pre-work.
Yeah, they have to do a hell of a lot of pre-work.
Right.
Yeah,
But those students need to be told that.
right.
They have to do even more pre-work. We had a refresher course in the summer that was online. Do you have that?
We do, it's not
You do. I think you do.
Yeah,
we're trying to make it available to all students.
Yeah, because we made the students who didn't come with biochem do this refresher. It was an online course. I don't know how it worked. But we told them you need to be up to snuff more. This guy is showing 2 cycles of biochemistry in his muscular dystrophy talk because it relates to glycogen metabolism and stuff. And he says, do I need to go over them? I said, absolutely not. You're not allowed to go over those slides at all. Don't even do that. They're supposed to know this stuff. And I said, you cannot go. I'll allow you to show the slides so they see this is relevant, but you cannot go over those slides. So there is a premise here of this is a formulatic process that I'm describing.
Is there data that this method really does long-term retention better than anything else?
Well, there's data, plenty of data, that active learning has increased retention, for sure. That's for sure, because if you look about, there's tons of data on, forget about medicine, just doing tasks and learning, just like if you think about technical school, auto mechanics, how do they learn? They learn by doing. They don't sit in a classroom and learn about how to take care of a car. They learn by doing. Why are we putting early patient care experiences in? You think we have nothing else to do with our time?
Do you call this lecture active learning or engagement learning?
I think that's a matter of semantics. By doing active learning techniques, you're engaging the learner in thinking and clinical reasoning and critical thinking. So the engagement comes from you and me engaging. The technique is an active learning technique or toolbox.
Yeah, but in this particular case that you were showing, 3 or 4 students answered the question. I've seen the others in the back that you really
Right. So it always happens that there are more students, and you have to really give this guy a break. I think this was his first talk. But somebody really, I have a tape here. If you want to stay after, I don't have a train until 7. I could show you our best, we've had 1 Best Teacher of the Year award. 1. We're a brand new school like you. So last year, Hofstra has these Best Teachers of the Award in every discipline, so we decided, well, what about the medical school? We have best teachers here. So we got our Best Teacher of the Year. They gave it to this guy, David Elkowitz. I have a video of him teaching. He has so many people engaged. He's an amazing teacher. I didn't want to show you his because to reach his level, the way he does it, I mean, if the students were allowed to give the Best Teaching Award every year to the same person, he'd get it again and again and again. They made a rule. You can't get it for 5 years after you get it.
You don't have to convince.
No, I'm just trying to say. So he'll get there, this guy.
But the problem here, and we were discussing with some of my colleagues, is the pre-reading. We have problems that students don't read previously, and then they come to a practical or to a lecture, and then you have only 10, 15, 20%.
So the others realize very quickly, I'm losing out here, and when I get out of there and I don't understand it, I better do something. It's like the same thing in the clinical setting. If there's a case that they don't read up on before getting there, the person who read up is going to be much more able to process what's happening, and therefore it's the same in every environment. But if you allow, like I was consulting up at Montefiore in the Department of Orthopedics. They were having a problem, and they called me back, and it was interesting. So I say, what happens if a resident comes to the OR unprepared, has not read up on the case? One faculty member said he lets him stay. The other faculty member says, I tell him to go home. Well, the one who told him to go home, it's much more of an impact that if you don't do your work before coming into the OR, you're not going to assist me in this case. So you have to stick to your guns a little bit here. And if you think pre-work, that you've spent the time to design the pre-work, you've put it up online for them, you've selected it, and we very much handpick our pre-work, and we don't give thousands of pages of pre-work. You want to stay after? I'll show you a Blackboard site. I could show you for his talk, his exact talk, how much pre-work there was, for that talk that he's giving. You must be reasonable in the amount, because this talk, this session, is 1 out of how many in the week? We have 22 hours of class time. This was 50 minutes. That's all we're allowed, is 22. That's all it's a very strict rule. If you want a half hour more, you have to go to a committee. I'm telling you. So his 50-minute talk out of 22 hours of class time, he can't have so much pre-work. But it has to be the right, on-target pre-work. Go ahead.
So he first, because
Okay.
he has.
Do you share the slides with them before the
Okay, so this is the deal with the sharing of the slides. They get the slides right before the lecture starts. Every lecture, so they can take notes on the slide deck. They don't get it earlier. So it goes up on Blackboard right before the lecture starts. The course manager puts it up. Sometimes there's a version that goes up after that, a second version that has more detailed stuff that the faculty member doesn't want to give them ahead of time, like answers to questions. And they'll give them a second slide deck after the talk.
Yeah, we've given them early, and I've sat in the back of the room, and half the students are with the lecturer, half of them are doing something if the quarter are doing something completely different, and a quarter of them are way ahead of the lecture. They're on slide 32, and the lecture's on slide 2. So,
very quick, related to two things. Number one is, are these lectures mandatory for students?
Yeah, we don't have any voluntary situation.
Okay. Then number two, are they recorded?
No. So they're mandatory.
They have to be there and participate.
Right.
Otherwise,
Right.
nothing they can do.
Right.
Okay. Thank you.
Yeah. Because the pre-work, if you could use a pre-recorded lecture as your pre-work, but that would not be what would be delivered in the session.
Mm-hmm.
So the flipped classroom that uses a pre-lecture, I mean, this article I gave you today is first coming out in February 2014 in Academic Medicine. It's a pre-read article. And you could do a lecture, but it won't be it's only a preparatory lecture. I mean, it says it beautifully in the article. This article is a fabulous article. So, can everybody try and write one question based on what was handed out? How about that?
Okay.
As a table. Do it as a table. Make it easy.
So these topics and learning objectives came from the Excel spreadsheets that you submitted to us and those are your objectives.
You don't want to see the think, pair, share? I would love them to write a question. A question. Cindy, a question for the goal. If you say you're going to see his think, pair, share. Related to the goal, I don't know what she gave you. To achieve the goal, what question would you ask? I'm losing people. I want to show you his think, pair, share. If you don't want to do that, I'll show you this. Okay. So, what did you hand them, Cindy? So how would you write a question to ask the students to have a discussion about, do you have a goal there? The objectives. Okay, so give me an example of one of the objectives. Okay, so develop a vocabulary for fungi and fungal diseases. So if that was your objective, what questions would you ask the students to see if they have that knowledge? It's not so easy to do this. What question? Can anybody think of a question that would help you understand if the students have that knowledge? Without the right questions, you'll never know. Anybody have a question? Go ahead. I have a volunteer, brave volunteer.
Not having a lot of memory about fungi, can anybody give 3 different fungi names of 3 different fungi?
Fine, that's a baseline question. Foundation knowledge. Okay? Okay, what could be a higher order question? Even I'll think of this.
Show them a chest x-ray with with a hole in it or a cyst, and then show them one where the cyst is filled up, what's the most likely fungus to have caused this?
Okay. Or compare and contrast. You could have 3 different fungi on here. Compare and contrast the presentation of these. They're all fungi, but compare and contrast the presentation of those fungi. What do you see different in them? Fine. Describe a classification scheme for fungi. Does such a thing exist?
Yeah.
You're an infectious disease doctor, so probably you know that. But do you see how it's not so easy? Go ahead. You have one in the back?
So you asked a question.
Oh, I thought you had a question.
As a lecturer, you also have the answer ready, so to speak, after the discussion, so that you can summarize it.
If you need to. If they do a good job, you don't waste your time on summary. You just go on. If they don't do, this is what I recommend to faculty. Thank you very much. So this guy who's teaching this muscular dystrophy that's so complex, I do have summary slides in his presentation because I'm afraid the students are not going to get it all. I mean, it's very hard. I don't even know why they're having this talk now. Even, I mean, even the person who's course director is wondering why we're doing this, she said to me, because it's taken us 9 hours to help prepare this guy and we're worried still. But the point is, I had him put summary slides in, so if they don't get it exactly, he can go to his summary slide and show it. I want to show you the think, pair, and share, because it really worked beautifully. You have to turn the lights right here. Right here. Yeah, he told me this. It's going. It's going, it's going. Be patient. I want to show you his think, pair, and share, how beautifully it worked. Watch this. So he has up here a woman with this skin thing. It's hard to see the image, but he's teaching immunology, and this is a skin problem.
Take a little break here, and then you want to take a break now, or you want to continue? You want to continue? Okay.
They don't want to break. Could you imagine?
Okay. This is a group exercise. Okay. I want you to. This game was brought to EPR, high blood toxin levels. They took skin cultures, taken at livery, where we grow E. coli, group strep, and then Staph aureus in Canada. So get back into your groups and talk it over, and tell me what you think is happening to the immune system. That's the question that I want.
Question is, what do you think is happening in the immune system of this person? Just watch closely. I know it's hard, but you'll see the level of activity.
Everyone else? Does anyone else need more time? I'll give you 5 more minutes then, with that motivation. Are you ready to go? All right, let's go. Come on. Okay, what was the first thing?
Oh, me?
Sure.
Oh, that the mother had group strep and wasn't on antibiotics as recommended by, you know. As a baby, right? Like until it's born.
So he's asking them what they spoke about.
Okay, right. Right. Anything else? Yes. Newborn, just right out of delivery. I don't know if the mother's breastfeeding. Probably not, but let's assume the mother's not breastfeeding. Yes?
It seems like these are all infections that the mom may be able to.
Okay. Let me just go to the end. I just want to show you how he summarizes, and then I'm done.
Cells are getting in.
Okay. Turn the light on, Cindy.
Yes. Okay, you want to take a break? Okay.
Okay. Let me just, I'll summarize and, okay. So the Think, Parent, Share really got a lot of discussion going in the room. It was really very interactive and they had a lot of questions. It really worked beautifully. I just want to tell you, this gets into that you have to prepare your questions. You can have spontaneous questions and think out loud with the students, but this really talks about having exploratory questions and then focus that are prepared. And this was the activity, the Think, Parent, Share, and these are some guidelines. And this is a lot of information on how to prepare questions that I'll leave with Cindy. It's on the PowerPoint, all types of questions you could ask. And the last thing was the different pedagogies. So I gave you a handout, the menu of pedagogies. There's lots of them described on there. Small group, large group, they're divided. And I gave you these 3 websites that have great stuff about interactive activities to use in the classroom. So I covered that. That was my last objective. And then when he comes back, he works them through this clinical diagnosis with this patient. We have to figure out. And these are some summary of large group best practices. 3 take-home points. Revisit these points throughout the session. Add your questions to the slide. 20 minutes of content for a 50-minute session. 1 to 3 slide introduction. 5 minutes at the end. Summarize always. And ask for final questions. This is my evaluation. Did I achieve what I was going to? And this is from Eric Mazer. A lecture is where the notes of the professor are transferred to the notes of the student without passing through the brain of either. Eric Mazer, 2009. His stuff is great. Thank you.
I'd love to see that lecture that won the prize.
Oh, yeah, I have his video.
Yeah, I'd love to. If you,
Okay.
How long is it?
And then I could also show, I could bring up Blackboard if anybody wanted to see how questions are really embedded. It wasn't so much for Joel, but I have like this very young faculty member, how I have her questions right up on the slide so she doesn't forget to ask it, because young people get nervous and they'll start just talking and they won't ask the questions. I've seen it all the time. So they get very annoyed at me. I say, you must put the question on the slide because it reminds them to do it, and they don't have to remember it because, once again, they're not having the note part of it. First, they think they're going to write the question. I said, no, you're going to be in the center of the room. You don't have that. So having it on the slide, it's there. It also takes care of the student that's falling asleep. When you ask the question, they see it on the slide.
So how many students are in?
We have 80 now. It's so many. It's ridiculous. 100 next year. I don't even know who the first-year students are, the 80. It's really hard. I got the 40 and the 60 under control. The 80 I'm really having a hard time with. Next year, our 4th year. That's our max.
You said that you had 22 hours.
He was teaching second years. That was a group of 60.
You said you had 22 hours of instruction. Is that, how many hours of large group instruction do you have?
So it depends on how the session is created. There's no formula. In other words, there's 6 hours of case-based teaching a week. Monday, Wednesday, Friday, 2 hours each day.
Right.
Like you have ALG here.
Right.
And then anatomy is half a day, once a week. We start anatomy day 1, though. The day they come to medical school, they start anatomy. So that's half a day, that's 4 hours. So that's 6 and 4 is 10. And then there's the rest of the hours, it depends. So like I also co-direct the communications curriculum, so we have 2 hours of that a week. And that's all small group. That's not large group.
How many large group?
I'd say we have 3 to 4 hours of large group sessions a week. on an average. I'd say 3 to 4 at the most. Because, yeah, so if we had, yes, 2, maybe at the most 6 and the least 4. How's that? Does that make, of the most? What? And I'm talking about a 50-hour session, 50-minute session, not a double. We do have some faculty who do doubles. So what did you want to see that excellent teacher? Yeah. So if we could come around the computer here, it's much clearer on this screen. I have no problem.